Following is a video describing pin site care for external fixators. Pin site care is to be performed daily. Its purpose is to prevent infection and control drainage from the pin sites. For the first 3 weeks post-operatively, your external fixator will be wrapped in an ACE wrap and there will be bulky dressings on the inside. It's very important not to disturb these dressings for the first 3 weeks. Either myself or my office staff will handle the dressing changes for the first 3 weeks. After 3 weeks, you will take over pin site care and wound care. It is nice to have someone help you perform these activities because it's quite difficult to reach down and do this on your own. For supplies, we have a pre-assembled kit assembled at Norco Medical Supply. Will give you a prescription. You can go there to fill it. The kit will include gauze in a sterile package, it will also include 70% alcohol, Hibiclens, which is an antibacterial. The way that you begin pin site care is to mix the Hibiclens into the alcohol. The ratio is about 1 part Hibiclens to 10 parts alcohol. Basically, you're just trying to give the alcohol a pink tint. It's important not to use too much Hibiclens because your pin sites will then become quite sticky. Pour the alcohol Hibiclens mixture into the gauze, soaking the gauze. Then you remove a piece of gauze, wring out the mixture as much as you can to make the gauze as dry as possible. Then you'll use this gauze for your pin site care and dressing. After you have your gauze prepared, remove the dressings from the pin sites as seen in this video. The way that you do this is to pull back the rubber stoppers away from the skin and remove the gauze which was placed before from the pin sites. This is what the frame will look like with all of the gauze removed. The next step is to clean the pin sites. Once again, you perform this by wringing out the gauze and to make the gauze as dry as possible. Then you go to the frame and use a dental flossing motion on both sides of each pin to clean the pin site. Typically, one piece of gauze will last for about 3 pins. It's very important to remove all scabs and crusted material away from the pin site at the pin skin interface so that you have a nice clean pin site each day. I'll talk about pin tract infections later, but if a pin is infected, you generally want to use one piece of gauze on that pin and not spread the infection to other pin sites by using the same piece of gauze on clean pins. The next step is to dress the pin sites. Once again, you wring out the gauze so that it's as dry as possible. Then you place one piece of gauze at each pin site and use the rubber stopper to gently hold the gauze in place. You don't want to push the rubber stopper down too hard because you can cause too much pressure on the skin. Just enough pressure to hold the gauze in place. The technique here is shown wrapping each pin site. You can also just fold the gauze over the pin site and use the stopper to hold it in place rather than wrapping it. This will make taking the gauze off a little bit easier. Here's a picture of a frame with the gauze in place. You'll see that at this point you really don't even need a cover or an ACE wrap. Alternative pin site care protocols include just showering with antibacterial soap to clean the pin sites and then placing the dressings on as seen before. Hydrogen peroxide can also be used for troublesome pins, especially pins that are infected. If you are going to use hydrogen peroxide, it's very important to dilute it down with some sterile saline and not use it at full strength. It can burn the skin. Things to avoid are no ointments such as bacitracin or neosporin at the pin sites, no hot tubs or non-chlorinated pools, and no swimming in natural water such as rivers, streams, or oceans. Pin site infection is common. It rarely results in long-term infection, and it really is not something to worry about so much, and it's easily treated. Signs of pin tract infection include redness in the area of the pin or wire, especially increasing redness from normal. It is normal to have some minor redness at the pin site, but not too much. Warmth in the area of the pin site, swelling around the pin or the wire, drainage from the pin or the wire. Some clear drainage is normal, but pus from the pin site is not normal. If your temperature is over 101.4, then it could indicate a more serious pin tract infection. The treatment of pin tract infection is more frequent pin site care, up to twice a day, and oral antibiotics for 10 days. If you have any questions about pin site care, please feel free to call the office with any questions or concerns.